Hey guys, welcome to Medifaction. Today, let's learn about abortion. Abortion is the termination of pregnancy by any means before the fetus becomes viable. The viability of the fetus comes around 24 to 28 weeks. The weight of fetus is less than 500 grams. Now let's get introduced to some of the terms used for abortion or termination of pregnancy. The first term is miscarriage, which means spontaneous abortion. The next term is induced abortion, which means termination of pregnancy by medical or surgical methods. Then we have therapeutic abortion, which may be either induced abortion for medical indications or induced abortion at the request of women not for medical reasons. Then we have medical termination of pregnancy, induced abortion for indications described under Medical Termination of Pregnancy Act implemented at 1971. Risk factors for spontaneous miscarriage, which may be due to maternal age, previous spontaneous miscarriage, low folate levels, high consumption of caffeine, NSAIDs at time of conception, very low or high BMI, which means body mass index. Also, smoking may be a risk factor for spontaneous miscarriage. Now let's discuss about some of the etiology or causes of miscarriage. First, we have chromosomal defects, which may be due to aneuploidy, structural aberrations, or mosaicism. Other reasons are congenital anomalies, uterine anomalies, which may be either uterine septum or even submucous fibroid. Then we have cervical insufficiency in second trimester. Infections could also be reasons, such as Listeria monocytogenes, Toxoplasma gondii, Parvovirus B19, Rubella, Herpes simplex, Cytomegalovirus. Some of the maternal medical conditions which may be an etiology are thyroid dysfunction, polycystic ovarian syndrome, uncontrolled diabetes, and Cushing syndrome. Some of the immunological factors are SLE. SLE is an inflammatory disease caused when the immune system attacks its own tissues. Also, antiphospholipid antibody syndrome could also be an immunological factor. Prenatal procedures, which may be chorionic villus sampling, and even amniocentesis could be a reason for miscarriage. Cervical incompetence. Painless cervical dilation in second trimester with membranes bulging through cervical canals, followed by expulsion of an immature fetus which is apparently normal and may show signs of life along with placenta. It is a recurrent condition and to be treated in subsequent pregnancies. Causes of cervical incompetence. Congenital causes are rare. Acquired causes may be due to surgical operations, forcible dilations of the cervix in D&C, cone biopsy of cervix, and catheterization of the cervix. Diagnosis. In non-pregnant state, diagnosis can be done by Number 1. Hysterography. Number 2. Easy passage of number 8 or number 10 Hager's dilator in premenstrual phase. Easy pulling of Foley's catheter with inflated balloon through cervical os. During pregnancy, TV ultrasound can be a diagnostic method. Also, shortening of cervix or funneling of the internal os, weekly USC or ultrasonography 14 to 24 weeks, cervix length less than 2.5 cm or presence of funneling is considered abnormal. Management. Treatment is surgical, consists of reinforcing the weak cervix with a suture. Suture is placed after 14 weeks of gestation so that early abortions due to other causes are over and not later than 24 weeks. Ultrasonography to confirm fetal viability and to exclude congenital malformations. Any obvious cervical infection should be treated. Now let's see some of the types of abortions. The first one is threatened abortion. Symptoms are amenorrhea, slightly colicky pain in the abdomen, slight vaginal bleeding, and frequency of micturition. Number 2. Inevitable abortion. This term denotes that the POC has separated from the uterine wall and is therefore bound to be expelled. The third type is incomplete abortion. When the products of conception are expelled and partially retained, it is called incomplete abortion. Symptoms are history of amenorrhea, lower abdominal pain which may be moderate to severe, bleeding from vagina which is heavy, and history of expulsion of products of conception. Complete abortion. Complete abortion is when the entire ovum or products of conception have been expelled. The next type is missed abortion. In this condition, symptoms of abortion occur but subside later without any products of conception being expelled. The embryo dies but is retained in the uterus. For this, the symptoms are amenorrhea with symptoms of pregnancy which may have subsided. History of threatened abortion may also be a symptom. Septic abortion. Septic abortion is an infected abortion complicated by fever, endometritis, and parametritis. Most common cause of morbidity and mortality is septic abortion. Hope you have understood the video. Like, subscribe, and press the bell button for more videos. Thank you. Thanks for watching.